All right. Had a little sidebar person coming in on that video. I apologize. My son went through, if you saw him or not. But on the picture 582, you can see the redness in the person's hands. You can go on their feet. It can go all over your skin. It might just look like a rash, like a reaction to some kind of food. But again, if you're sexually active, you are at risk of any of these diseases. If you're not sexually active, you're choosing to abstain, you're all good. You have nothing to worry about. All right. Seeking treatment, you need to go to your family doctor. All right. You can't just let it go. Because again, you can have multiple STDs. All right. Multiple. And the best way, again, to avoid any of these situations is to abstain. So we're moving on to the latter part of section 2. You're going to be doing section 1 and section 2 questions. You're really going to be doing all the questions to the chapter. All right. I posted on Schoology which ones you have to do. I think I said, let me look back here really quick. Section 1, you're doing 1 through 4, and that's on page 577. Section 2, on page 583, you're doing 1 through 5. Eventually, you're going to do all of them, okay? So, let me recap again. Abstinence is the key, 100%. If you are not sexually active in any of the 4 forms, skin to skin, sexual intercourse, that's penis, vagina penetration, oral and anal skin, giving and receiving. Giving and receiving. If you choose to abstain from any of those 4 forms, you don't have to worry about any of these STDs. STDs are all treatable. Not all of them are curable. The bacterial ones are treatable and curable, but if untreated, it can be worse, like possibly death, like in syphilis. Now, the viral STDs, basically anything that starts with an H, they are not curable. They are treatable, but not curable. They're with you for the rest of your life. Some of them can be dormant, like you may not see symptoms. They'll be called asymptomatic. A lot of these diseases, these infections, are flu-like symptoms. That's the crappy part about it. You may think you literally have the flu. Now again, if you're not sexually active, you might just literally have the flu. But if you're sexually active, you could have an STD. So you're going to be reading sections 3 and 4. And I posted in Schoology, section 3 on page 589, you're doing questions 1 through 4. And then on 596, you're doing questions 1 through 3. So, HIV and AIDS. It's not curable at all. It's a virus that affects your immune system. Everybody's immune system is different. Like everybody's fingerprint is different, okay? Our genetic makeup is different. So when it comes to HIV and AIDS, it deals with your blood. You can get the virus through semen. You can get the virus through breast milk if the woman's pregnant and she's feeding her baby. And you also can get it through vaginal secretions. So if you're having sexual intercourse. So I mentioned before, like I'm an 80s kid, and in the 80s, HIV came to a head in the sense of acknowledgement. And all kinds of wrong meanings behind it, like how it came about, were not true. It's a disease that came through where people were, from one person to another, having sex. So you want to understand that it attacks the immune system. Your immune system fights off bacteria and germs. You have these T helper cells. The T helper cells are what fight off diseases or infections. So I don't know if you're aware of like the Pac-Man game back in the day. The Pac-Man would come and eat like the pellets, right? Okay. So here's like your T helper cell, and it has a myelin sheath around it that protects it, right? So the HIV virus is floating around and it's looking at your T cells, and it starts attacking it and eating it. And what happens is it starts morphing itself into looking like a T helper cell, but really it's not. It's camouflaging itself, but it's eventually killing off your cells, your T cells. So you have stages of HIV. And the sad thing is some people don't even know they have it. They're still continuously having multiple sexual partners or sharing needles, making poor, risky choices. And be in mind that condoms do not work all the time. They're not 100% effective. That is why we promote abstinence, because a lot of things can happen to the condom. So asymptomatic, that means you have it, you just don't show any signs or symptoms, okay? So you're lacking like responses, or your body doesn't show signs, okay? So it's exposure to the infection. It may be more like flu-like symptoms. You may not feel well, but then you feel well a little while later, and then a couple months later you feel really bad. And you're still living your life. But remember, once the HIV virus is in your body, it is destroying your T cell helper. T cells are helper. You're destroying that. And then it merges on to the next stage, which is systematic stage. So you are showing signs and symptoms of the disease, the infection. And the scary thing is, HIV can be undetected, meaning no signs, no symptoms, up to 10 years. That's really scary. So your average high school kid's 15, 16. If you choose to be sexually active, you may be asymptomatic, show no signs or symptoms of HIV at all, up to 10 years. So then boom, now you're 26 and you're done with, you're starting your career, maybe a family, then all of a sudden you get sick and you don't know why. And then you find out you have HIV and it's been in your system for 10 years. It's very sad and very scary. So you're showing signs. It could be up to 7 to 10 years. It affects everyone differently. You have to remember that. Then it falls into AIDS. So at a certain level, your T cell helper count drops. If it's under 200, you now have AIDS. So there's many doctors that have different types of medicine for people with HIV and AIDS. Usually it's the AZT medicine, but now there's multiple kinds of medicines. It's how our technology's evolved that helps people live longer, which is a good thing, but you still need to practice healthy forms if you are involved with somebody and you have the HIV virus, because your partner will eventually get it if you are not safe. So again, there's a little chart here that shows you the asymptomatic form to the systematic form to AIDS. Now, there's no cure for AIDS. You will eventually get AIDS if you have HIV positive. Some people have been walking around with HIV positive, not even knowing it, and then boom, they have AIDS. They're like, well, how did this happen? Well, you weren't taking care of yourself and you're making poor, risky choices. That's why you want to stay on the right track of making good, healthy choices for yourself. Again, HIV, AIDS, all the STDs, chlamydia, syphilis, gonorrhea, trichomoniasis, herpes, HPV, all of them do not discriminate. Anybody can get it if you choose not to be smart when it comes to relationships. All right. So on page 586, I want you to read what opportunistic infections are. Then you have the risky behaviors regarding transmission of HIV. You're going to be reading that. I already said a few things about it. Multiple partners, sharing needles. Okay. Most IV drug users, they're wigged out and they don't clean their needles. But again, people who use drugs can be just like anybody. Could be the person down the street. When you're in contact with blood, that's a factor. So that's why, when you go to the doctor, they have masks and gloves on. If I'm teaching in my class, like in the gymnasium or in the health room, and someone falls and knocks their head and there's blood, I put gloves on because you just don't know. Again, there's no signs or symptoms a lot of times. Contraction from the mother to the baby. I mentioned earlier that whatever the mother eats and drinks and does to her body when she has her baby in utero, it does affect the pregnancy. So yes, the baby is more at risk of getting the HIV virus because the mother has HIV positive. And when you go to the doctor, like OBG, you can take all these tests, and they ask you a bunch of questions. And if the mother is HIV positive, they will start treating the mom during the second trimester with medicine to help prevent the chances of the unborn child of getting the HIV. Now, there's no 100% guarantee, all right? But it reduces the chance that the baby will not have the virus, all right? If the mother's breastfeeding and she's got the virus, it's going to go through the breast milk to the baby, all right? Just like if the mother was smoking cigarettes and she's breastfeeding, that nicotine, those poisons of the cigarettes are going into the baby from the breast milk. So do not do that. Safe behaviors I mentioned before. When you donate blood, someone said to me, well, Miss Hawkins, what if I donate blood? Am I going to get HIV? No, if you're donating, you're not. Okay. But back in the 80s, people who had, well, even nowadays, but they check donor blood much better than they used to back in the day. Hemophiliacs, people who can't have blood, like they have blood and they can't clot their bloods, there were a lot of people that were hemophiliacs that had the HIV virus. But nowadays, they're able to perform more efficiently testing the blood when you go and donate blood. So again, you want to make sure you're educating yourself. You want to be proactive. You want to have high standards. You want, in the sense of you don't want to risk your life. You don't want to risk your goals and your dreams, reputation. You want to make sure that, you are showing precautionary measures, perhaps what if you and your friend are longboarding, and your buddy falls and skids his knee or elbow and starts getting gravel burns and there's blood there. Don't touch it. Don't freak out. But, if they're able to take care of it themselves, then have them clean it off. But you should not touch it unless you have gloves, okay? So you're going to be working on Section 3 questions 1 through 4, like I mentioned. It's on page 589. And then, bear with me. All this talking's making me thirsty. Section 4, protecting yourself from AIDS, HIV and AIDS. Again, I've mentioned numerous times, over and over and over again, abstaining from drugs and abstaining from sex. Just choosing to make good choices. It's very simple. It boils down to self-esteem, self-worth, confidence, how much control you have of what choices you make in your life, no matter how good looking that guy or girl is, no matter how much he or she tells you that they love you. Is it really worth your life? Is it really worth becoming a teen parent? Is it really worth having to ask your parents or guardians to take you to the doctors because you have these bumps on your penis and vagina and now you find out they're genital warts that are going to be with you for the rest of your life? And the treatment, yeah, you can get some cream. Yeah, they might laser them off or burn them off for genital warts, but they're still going to be in your system. It's going to be in your body. And what if you make a mistake in high school or early college years or your early 20s, and then you eventually find someone that you want to be with and you have to tell them, hey, just to let you know, I have genital warts. They're with me for the rest of my life. And if you and I stay together, you're eventually going to get them too. Now think about it. If, say you decide to get married, right? And you talked about your relationships with other people, if you were in them or not, what you want to be as, do as a couple, your goals and dreams as a family. And then you're like, yeah, I got to tell you something. And then you tell this person that you have genital warts. And they're like, what? Do you think perhaps that person may or may not marry them? Think about it for a second there. That's a heavy load. I mean, that's a very heavy load because eventually you are going to, if you're with that person, marrying that person, you're going to have sex with them. It's inevitable, right? Because you're married. You're going to have kids. Well, that might break it. You may be like, I don't want to deal with that. So you guys got to be smart. Know your boundaries. Keep your goals and dreams. Keep your self-esteem. Don't put yourself in risky situations because, again, STDs don't discriminate. The bacterial ones are curable and treatable, especially when caught in time. But if they're not caught in time, they can get worse, okay? The ones that are viral, they're not curable. They are treatable, and they're with you forever. So you have to think before you react on these things. And it's not always about being physical, people. You can show ways that you care for someone and love someone without being physical, okay? So avoid contact with blood or any body fluids. Ideally, everyone wants to, be with one person in their life. Protection barriers, which is like condoms. But again, I told you, condoms are not 100% effective at all. As a matter of fact, they're like, let me see, if they're used all the time, consistently, correctly, all the time, research shows that they're 83% effective. That's 17% that you could still be at risk of getting someone pregnant, being pregnant, or getting an STD that's with you for the rest of your life. So the best thing to do is to choose to abstain. Choose to abstain. They have ways of testing for HIV. So you can have an HIV positive diagnosis and, of course, follow-ups. They want to follow up with that. You're going to be on multiple medications. It's not just one. I had a teammate of mine that fortunately she didn't have HIV, but she thought she did, and she was kind of freaking out about all the pills she has to take. And they were telling her, if you are, now mind you, she's not. But she was going through all in her head. Oh my gosh, what if? And the doctor was explaining to her, well, you have to take certain medicines throughout the day. And so you have to have like an alarm that tells you when you have to take medicine throughout the day. That could be very stressful and tiresome. But again, HIV and AIDS treatment, not curable. T helper cells are the cells that fight off infections. So you want to be able to have your T helper cells 200 and above. So again, if someone is dying of AIDS, more than likely they're dying of like pneumonia or liver failure, because it eventually breaks the immune system down and everything else starts breaking down because of the disease. You want to make sure you read about what viral load is. Hint, hint, viral load. That's a vocab word, and in your book they're highlighted. That's on page 595. That's going to help you. A lot of times when people have HIV, they have multiple drugs, and they call them like cocktails, like cocktail drugs. Living with HIV. You can live with HIV. I mean, you can work, you can have a family, but you have to be smart about it, and you have to, be careful of when you do get sick. If you do break down with like the flu or what have you, like temperature, but you can function in society. You can have a job. You can have friends. You just got to be smart and educate yourself. Educate, and you need to get a support system. So section 4, page 596, you are going to be doing questions 1 through 4. So this particular chapter, you're not going to do the vocab, but I want you to read the vocab. You're going to read the chapter. You can do the section questions. All right. And that's a lot of stuff I just said. And be positive, be proactive, take care of yourself, because again, bacterial STDs, treatable and curable, unless you don't take care of them. Infections can affect you in any way. STDs that are viral are not curable, but treatable. So the viral ones are the ones that start with H. That's how you can kind of remember. And the bacterial ones, you can have both. You can have all of them all at one time, which is not good. So again, choose to abstain, be smart, make boundaries, love yourself first. Take care.